Is shopping or cleaning up or meal preparation. My son, he works in an assisted care facility up in Arkansas. They call him assisted care assistant is what he does. And they have these little miniature apartments inside this whole building, and it's sort of a neat concept. It's sort of a neat concept. Skilled nursing facility. Skilled nursing facility, and you could see within a nursing home, you could see a skilled nursing facility. But what I want you to maybe think about more like the Warm Springs, the rehab. Person that was in an accident, they got paralyzed. Or maybe the lady, remember you've been seeing on the news, one had flesh eating, she had to have amputations, she had to go to a rehab. Skilled nursing rehab center, because she's going to have to relearn how, or she's going to have to learn how to function now with the amputations. I just gave you an example there about the elderly person that lives alone. They would come from hip surgery. We typically will see those individuals go to a rehab, from the hospital to a rehab, because they're learning how to walk around it, you know, how to fix their meals, how to take care of themselves, how to do their bathing. And it just doesn't happen with the short stays that we have in the hospital. Then, of course, you have community health. That's working with health department entities like that. Now, guys, when I tell you to don't forget to review your electronic study guides. You'll see that sometimes you'll say ESG in your book. That's what that is referring to, is that CD. Healthcare delivery systems. And again, I see how I emphasize it. Don't forget, electronic study guide. There's categories of healthcare. You have the primary, that focuses on health promotion, preventive services, early screening, primary, early detection. Secondary hospital-based care, and then tertiary, those long-term rehab services also care for the dying. We have nursing care models. This you won't necessarily find in your textbooks so diligently outlined, do you? Didn't really talk that much, but maybe in your secondary it talks a little bit more about it. Your volume 2, I mean. Case method, functional nursing, team nursing, and primary nursing. Case method, you think about total care, one-to-one care. One-to-one, that nurse is taking care of that one patient during that single shift, one-to-one. Functional, it's compartmentalized. And some of these systems don't work as good as others. Team nursing, I've seen that used a lot years ago when they would allow LVNs into the ICU. We do a team nursing kind of concept where the RN would be over some LVNs. The LVNs did the direct care, but yet the RN was still responsible for those patients. And you'll see that also on the floors of hospitals that still allow LVNs in. A lot of these hospitals, they've gone to what's called magnet status, or they want magnet status, and hence they have tried to boot out the LVNs, and they have in a big majority of the cases. And then you have primary nursing, where a nurse manages a care group of a patient, and they develop a whole plan. You know, she sort of engineers the care. And here's the trends in nursing healthcare. They want you to use, or want to consider using critical pathways. Critical pathways, your students seeing where these things, by using these critical pathways, these trends, these decision tree, they find that this is helpful for the body of a certain type of patient. But don't forget that everyone's individual, hence the individual nursing care plans. I just found that diagram on the internet. It made sense. It talked about a pathway. We must always remember when we are doing health care and we're doing delivery, the RN, now they're gonna be over certain individuals, the nursing assistant personnel. And we must not feel that, we must not put our job onto them. In other words, telling a nursing assistant to go change a dressing, or you see what I mean? Sometimes you'll see nurses doing that, and that's wrong. That's not within their scope of practice. And in all cases, remember, you maintain that responsibility. Whatever you delegate, it's still your baby. If things go awry, you must know what your workers' levels of competence and is it within their scope of practice to even do. Now we're into chapter 2. See how fast that flew? Flew quite fast. That. Where are you getting it? From your chapter 1. Did you see? If you went to your textbook chapter 1 and you counted your objectives. Everybody go to chapter 1, because I may be the only one that does it this way. Go to your first page. Go to your first page, 13. Chapter 1. You got to turn the page there. If you counted 1, 2, 3, 4, 5, 6, 7, see, if you counted all those, you'd see where that 13. Came from, right? Mm-hmm. You don't find that in your readings that they will delineate the objective. Do you see what I'm talking about?
I do, but that's what I use the blueprint.
But I went with the blueprint. How is it different? I just typed out here. Let's see.
No, I mean, these are, I can copy these because I'm trying to make sure.
Okay. Which one's number 11 on here? You counted 11.
Describe the healthcare delivery system.
And maybe that may have not been. Oh yeah, there it is. There you go. It was the third one down.
Yep.
Yes. You see how this is all related?
Mm-hmm.
Y'all see how that works? Y'all, it makes sense, doesn't it? Now I can't say that the textbook, I can't go no further. Yes. Yes, I will put those, after we get done, I'm going to look and see if there is a discussion in the dashboard. If it says discussion, that's where I'm going to click on that, and I'm going to put Unit 1 PowerPoint.
I couldn't write all fast enough. I was like,
oh, no. Yeah. But as you see, I have torn your book apart.
yes.
Y'all see that, don't you?
Yeah.
See how this thing makes sense? But I can't promise you that all instructors do that.
Yeah.
You know, but this is how I try to do. I do the best I can on it. We can move on to chapter 2, or unless there's no questions.
Just real quick, on the blueprint,
Yeah.
you mentioned 2 of the objectives.
Yeah, but that may not be on the blueprint, and you're saying yes. Go ahead.
Like, there's, obviously there's multiple objectives and
Yes.
stuff, but only 2 of them are on the blueprint, so do we focus more on the 2 that are on the blueprint? Okay.
But yet I thought, is that all I had for chapter 1?
There's only 2 of the objectives. The ones that
There's
are-
3. There's the fine nursing also.
Okay, yeah.
Okay, yeah, you see how that makes sense? But see, I'm going through, I do the best I can as far as tearing your book apart. Because it's just not all about the teaching to a test. Yes. Posted, I'm going to look and see in our dashboard if we have a discussion.
I might do it in my
Which I think after we get done here, I'll pull up our blackboard. And if that's true, that's where I'm going to do a discussion. And then I'm going to put lecture PowerPoint for Unit 1, so how we'll do it. Any other questions? All right, we can move on. Chapter 2, critical thinking, the nursing process. Now, guys, I will up front tell you that until you all get introduced to ATI, I don't want to introduce you. Till tomorrow, maybe, right? And I'm hoping that you guys this afternoon, as I understood from the orientation, the ATI rep's supposed to come into your pharmacology class. Wasn't that what we all understood? So I'm gonna let him do his introductions. And the only thing I ask of y'all, I know y'all wanna study, but if after that, this evening, if you guys will take that step and get yourself registered. Because we're gonna need that for those that come to Skills Lab tomorrow for Tuesday, right? And this whole week, what did we have in the morning time? We got ATI. Afternoon, you're going to do communication, documentation, and vital signs, right? That's what everybody's going to do this week for skills, right? Y'all already looked at that, right? Somebody nod, and then I'll say, okay. I will make sure I'm on the right sheet. So we'll move on and talk about chapter 2. And so why do we use critical thinking? Well, we have multiple and complex health problems our patients do, and we need these abilities. We need to critically think. We need to problem solve, make decisions, and use what they call clinical reasoning. I'm not going to wait till my patient takes their last breath before I do something. I'm going to pay attention, and I'm going to figure out my problem solve. I'm going to be calling my pulmonologist, and I'm going to say, you know, I've noticed that they sound wet this morning. They sound congested. I hear crackles, which y'all will learn about. Patient's weight is up by 4 pounds from yesterday. We've got this IV infusing at 150 cc's an hour. You know, I'm going to use some common sense. We can't keep on flooding them with fluids and thinking that they're not going to respiratory arrest because they're getting wet. It's just like somebody holding a person underwater, see? When you have flash pulmonary edema, y'all learn that in Adult Health 1 because you're always going to make it, right? You're going to get through first quarter, second quarter to get to Adult Health 1. Clinical reasoning, common sense, all those relate to common sense. Culture beliefs, and the clients. It's our responsibility to ensure that we're culturally competent. Each of our patients, they're unique, and they each bring with them their own uniqueness in terms of their culture, their cultural beliefs. And cultural beliefs of our patients influence how they will view health care and how they'll view their illness. And also they're going to decide at what point will they seek out health care because of their culture, their family values and things. They will actually decide what type of health care provider they will select. You know, they will. It all of our culture, our backgrounds, you know. Whether they'll choose to go with that nurse practitioner. Whether they'll choose to go to a male or female doctor. And then they'll also, with their cultural background in terms of deciding ultimately what type of treatment, because, you know, they get choices, you know. They get to choose. And now we're going to move on to kinds of nursing knowledge. We have theoretical knowledge. And theoretical knowledge is stick to the facts, right? We know, and you guys know, room air has got 21% oxygen, right? That's a fact. If I drop an apple, it's going to fall. Gravity makes it fall. That's a fact, right? These are evidence-based. Practical knowledge is knowing what to do and how to do it. It consists of processes and procedures. Procedures like what you guys are going to learn in this quarter. You're going to learn how to take vital signs this week. You're going to learn how to give a bed bath, change linens of an occupied bed. You're going to learn how to administer medications, injections. These are things you're going to do. Practical knowledge tied to procedure. Self-knowledge. Self-knowledge, self-understanding. It's for you to think critically and provide most holistic and complementary care to your patients, you must be aware of your own beliefs. You must know within yourself what you are, you might have some bias to. You must know yourself first before you can help others. Ethical knowledge. Are we morally correct? Are we morally sound? We know the difference between right and wrong. Ethical knowledge. That's pretty basic. You guys, we won't be getting much into the nursing process here because that's going to happen in chapters 3 to 7. That's the Unit 2 exam, right? Basically talking about what it is. The nursing process is a systematic problem-solving process that guides all nursing actions. We know that nurses must have both psychomodal and interpersonal. That's the communication piece. So I'm communicating with y'all are listening, and see how we had the exchange between going over chapter 1, chapter 2. You wanted to engage and talk to me, reassure that you understood me and I understood you. Hence I walked over, I wanted to make sure I understood what she was saying, right? And I'll learn y'all's names eventually, but maybe not today. I just found that was a nice little neat image, and I didn't get a virus, thank goodness. Nursing process. But in essence, when you look at that, it's a one-click picture and it sees everything that you would want to do in terms of a nursing process. That's what all we're doing. Phases of the nursing process. What do we do first? We assess. On state boards, when you sit for state boards and there's some sort of question, scenario about a patient, or what would you do first? I will assess. I will assess my patient. I won't just go in there and give a shot. I won't go in, I won't read, oh, well, this patient needs pain medication. I'll go in there and give them Tylenol. You won't do that. You'll assess it first. You gather your information. You assess. And I found this cartoon on the internet. My goodness, when was the last time anyone checked on this week? See? Assess. You always assess. That's the first thing. When you take over, when you're doing the walking rounds, you're the day shift coming in, night shift's leaving. Y'all gonna be doing walking rounds because you're gonna see what that night shift nurse has. Because see, that's what happens when you don't do these walking rounds. You get surprises when you go in the patient's room. They haven't had no monitor on them. Oops. Nobody's breathing there. They've already had their celestial discharge, right? They don't want to go that way. Y'all always want to do walking rounds. Assessment, first phase of nursing process. Diagnosis, second phase, you're identifying those clients' health needs. Usually stated in a problem. Planning. Planning is found in both the third and fourth process or phase of the nursing process, and it's divided into 2 parts: planning and predicting your outcomes, and then the interventions, AKA those interventions of what you're going to be doing. Planning interventions are also nursing interventions, those actions that you're going to do. The implementation, see, they get a little bit muddy, don't they? Planning and implementation. They see how they can both be, they go together. You plan, because see, I can be thinking about this patient. I can be thinking about this patient, and I don't even realize I'm doing this nursing process, but in an instant, I'm doing it. See, I see congestive heart failure. I know I need to do this, this, and this. I need to make sure. I got to see what that wave is. See, I got to gather my information. See, as I'm walking down the hallway, I'm already got my plan and my outcomes. The outcome is I got to get rid of them crackers because I heard them as I was walking down the hallway, because I know that that's going to lead to the demise or the respiratory distress of that patient. I'm going to take care of that fast because I want that patient to get it turned around. I'm not going to, I can't stand to know that here's a patient that's in this kind of condition, and because they're not complaining, that we're not doing anything. See, we can't be that way. Got to be proactive. So you'll find a lot of times the planning and the implementation, they sort of go hand to hand. Say, implementation, action. I'm thinking about what I'm gonna do here, that I wanna do here. You see how those go? So it's a little bit, they sort of cross over a little bit. You see that? But it's the plan, and then I'm gonna do what I planned. And then always, and this is where we're really bad about, we're always bad about evaluation. I don't know why, we're very poor about following up. And just because we planned it, and we want that outcome, doesn't mean that outcome's gonna happen. We'd like for that to happen, but see, it might not be what, and so then you gotta revise your plan. Because maybe it didn't work, maybe what you thought would work didn't work, so we gotta go with another plan, and of course, another plan's gonna lead to other interventions, right? And maybe those will work, maybe they won't work. So you're constantly using this nursing process, and you should be constantly evaluating. Always. And see how I lead right to preparing for your Unit 1 exam. Now, we won't have any math problems for Wednesday, but see, I want y'all to get in the practice. You see what she's holding? That's the 50-cent calculator. The Scantrons, you get them, I thought you, both Abby and BB, but go to BB's office first. But Abby told me that she also has them. She said either one, but. And that's a wrap for my lecture, because the rest of the time I want y'all, who all brought laptops? Okay, now, what I would need is I would like y'all to take enough time to form up, take your laptop and 4 of you. See what I'm saying? Not everybody has a laptop. Did y'all all that have the laptops, did y'all put your CD on them? Yes? Do you have your CD? Can you put it on? Oh, you can't. Why not? Oh, they don't. Can you access the information though? You can go online. Here they have Wi-Fi, and you're the guest, and you hit enter and enter. You don't have to worry, right? Have y'all done that with the ACCD?
She wants to do the CD for class.
So what I want is for us to use this entire work area over there too, and I want y'all to split up those that's got laptops. Y'all come forth and say, I want a group of 4 of you or 3 of you to come with me, and just break off into your little groups. And what I want y'all to do, I want y'all to look at and work together going through the, for chapter 1 and 2, the mastery exercises and NCLEX review questions. They will be very important for perhaps on Wednesday. So y'all sort of have an understand what I'm asking. There's about, how many people, raise your hand, how many has laptops? Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And I should have around 50 people in here. So in groups of 3 and 4, I want y'all to clutter yourselves together and just access these. Yes.
I have the questions, but they're all highlighted and corrected and everything.
Oh, with the NCLEX Master and
All of them, chapter 1 and 2.
okay, well, so still go with somebody that's got a laptop computer. Because eventually what I'm going to do, because we're short of time today, eventually I'm going to start having y'all work in groups and doing the critical thinking. And you guys that have accessed that CD disc, and let's do that real quick before y'all fill in.
I don't know anything.
See what I'm going to start doing.
Where do we meet? Because we
Dr. Moore, I have a question. So the people that's in the groups that's scheduled for tomorrow, they come to Skills Lab?
Yes.
How is that? We don't understand
I
it.
forgot to say that, didn't I? Skills Lab, those people, tomorrow report to 201 at 8 o'clock. And Wednesday, we need to follow up with whoever's teaching Skills Lab for Thursday.
Because I'm in Thursday, yeah.
Yeah, but 201 for sure for Tuesday. Y'all come at 8 o'clock.
And you come dressed in your whites?
No, in your casual with your lab coat and your ID badge. That'll be the Skills Lab. Now, casual dress with your lab coat and your ID. Right? And I would assume 201 for Thursday at 8, but at this point, I can't give you a definitive on that because I'm not teaching on Thursday. Yes, got a question?
Can I send you the information for the Facebook for all of us so that everybody can see it?
Yes, yes. Now, guys, eventually what's going to happen is you guys are going to, okay, let's stay with me here, stay with me. Eventually, guys, what I'm going to have to do, I'm going to always leave some time. You know, I had to cram a lot of stuff today, didn't I? But eventually, we'll be going into, like, say, like in the nursing process, if I started that. I will have y'all be doing these types of exercises where you're actually engaging in group discussion. And there's no right or wrong answer on these, but this is where y'all start to come together and discussing these, Mr. Garcia. You see what I mean?
Okay.
And so, but this time, we don't have much time. So that's why I'm saying, when y'all break away, let's don't break away yet. Or let me show you here first what I want you to do. And I'm just looking for y'all to do for chapter 1 and 2.
Did she say we should put the
These
CD in
mastery
there?
exercises. See what I'm saying? These mastery exercises and NCLEX review questions. Don't cheat and see the answers. Try to figure them out, see? But see, because that's about, we got 30 minutes left. So, does that make sense? And you guys are going to have to decide, those 11 or 12 of you's got laptops, you're going to have to say, 3 of you don't have laptops, come with me and get to a far corner or whatever. But so your name is Kim. I would like to turn this over to Kim. Yes, that's what I'm gonna let you do. Yes, and all this. Yes.
We had each groups, we were divided into groups, and one of them had to ask them how much time. And then the last one, they didn't tell me after we were to say what that female and the male was.
An asterisk. I have no idea. Well, look at that, maybe. Is it something, is it just on one group?
Maybe it's supposed to be a dash and it's just a typo.
Could be a typo. Could be. Was everybody assigned a skills lab groups?
Yeah.
Were you?
I learned, like, anybody would like to trade, on the A and B.
You're, speak up again now?
I'm group A, but if anybody would like to trade, I really like,
Which group do you need? B origins and you're an A? We'll take a look at it because I need to trade here.
okay.
Okay, so there we go. So y'all wanna make sure that that happens. And then what I would like is if y'all do that, if you'll send me an email. So I'll know what group is y'all were in, and then I have to email that to the associate instructor. Everybody else was okay? Is that your Facebook?
That's right. So if you just search this, it's already up. So just search it and then click message, like or add, or just like it, and then you're a part of it.
So does everybody understand? They have provided you, do they type in Facebook or?